Well, Danny Vargas, let me start with the simplest question of all. What's in it for me?
What's in it for you and what's in it for patients in general is a way to be able to use technology, information technology, to improve the doctor-patient relationship, to improve outcomes, to minimize overhead costs, to decrease the amount of errors that might take place with regard to patient interaction, with regard to billing. The promise of Health IT really is a promise that holds a lot of hope for being able to improve patient care, improve healthcare results, and create healthier communities. Now, getting from where we are today to more full adoption, that's the challenge. Being able to leverage the resources of the government and the private sector to be able to help some of the providers adopt, particularly in underserved communities, that's the challenge. That's why we, within the HIMSS organization, launched the HIMSS Latino Initiative to really focus on being able to help the adoption of health information technology within the underserved communities out there.
Sharon, I'm always surprised when I find myself hand-carrying images, paper records from one place to another. But I'm also consoled because I know that I actually had some consultation. I actually had some say-so over whether these things were transferred. I'm part of the process. When it happens without me, I don't know, I feel a little less secure. What do I have to worry about as we embark on this brave new world?
Well, I think what you have to worry about currently is the inconsistency in the system. You might go to a physician that is very well connected and can pull your images up right in front of you, show you all kinds of things, and then return to, say, your primary care physician who has no connection, no access to that. They don't want you carrying your records because they just showed them to you. You know, it's supposed to eliminate paper. So we're sort of at a crossroads of a dual system operating right now, which is confusing for providers and confusing for patients. And while we're talking about electronic medical records, I think the core of this is really how we're going to exchange that information among different sectors, including the patient, which is the critical part. You could become empowered to really manage your entire record portfolio.
Well, empowered, that's an interesting word because, Dr. Rollow, I have found over my life that healthcare providers often see this stuff as proprietary information because in a way it's part of their business model to keep you coming to them, and they've got this little pile of knowledge about you and they don't share well.
Right. And that's the traditional way that medicine has evolved. But we're moving in a new direction. And I would say one of the key components of that has been the redesign of primary care around the patient-centered medical home concept, which is really a way of organizing primary care medicine around a patient's needs and facilitating in an appropriate way the exchange of information between a primary care doc and a specialist or a hospital, et cetera. There are many challenges. I think there's no question about that, but the promise is such that we have to go in that direction. The current medical care system is just not sustainable. You might have been able to carry your records fairly successfully up to this point, but as medical information explodes and as patients such as yourself or any of us become involved with multiple providers, it just doesn't work. You've got to have electronic exchange in an appropriate privacy framework.
Well, Dr. Rios, let's talk about a community that's chronically underserved, the most underinsured and uninsured community in America, but at the same time, heavily urban, concentrated in the 10 largest metropolitan areas, which creates some benefits and some economies of moving things around from place to place. What should the Latino community be thinking as we embark on this enterprise?
Well, let me just say you hit the nail on the head. The health disparities in our communities are so ingrained in our generations after generations. It's a culture of poverty, culture of hopelessness, that health is one of the most fundamental feel-good things that everybody needs. And I think for a community that has so many health disparities compared to the general population, whether it's diabetes, HIV, AIDS, heart disease, cancers, the provider community needs to understand the role and the responsibility of creating the changes necessary to help connect the business community and the government with our communities to provide the new jobs, to provide the new hope that we can help change our communities through these changes that are happening with health IT. And let me just say just one last thing. In order to get the information to help our communities, we all need to be involved in understanding how to use the information to cut the disparities.